The series of rallies that snarled traffic around hospitals yesterday was touted as supporting healthcare employees who didn't want to be vaccinated.
But today, frontline workers are speaking up, angry and frustrated with what they call a disrespectful and disgraceful display by protesters. Here's CTV's Penny Daflos.
Thousands gathered in Vancouver, proudly maskless and defiant.
We need to stand our ground.
Joined by like-minded people in Kelowna and Victoria.
United non-compliance.
In opposition to BC's incoming health pass requiring vaccines to access non-essential businesses like concerts, gyms, and restaurants.
Fake news!
Now they've had their say, the healthcare workers who watched and listened to demonstrators.
You can't force an experimental substance or any medical treatment on anybody.
Are speaking up, and they are very angry.
It feels like a slap in the face.
For the healthcare workers inside the besieged hospital, each cheer, each vehicle struggling to get through the crowd to medical care was enraging. I've never felt more disappointed, disrespected, and defeated. Treating this like some kind of circus, said one nurse. The place for that is outside the legislative buildings, wrote another. And what a disgusting, misguided display of disrespect and ignorance. I've never been so disappointed in my community of Kelowna, wrote this doctor. We were working hard long before the pandemic. Morale is low, tensions are high, beds are full, wrote another. The Facebook group BC Business Against Health Pass is 100,000 strong, full of people pledging to operate and support businesses that won't enforce the vaccine passport, and applauded the demonstrators.
People are crying and sad now because they can't go to a restaurant if they're not vaccinated.
That kind of attitude has frontline workers increasingly speaking out.
I just admitted a 37-year-old gentleman because his oxygen was so low it was not compatible with life. And he said, well, I was waiting for FDA approval.
These are deeply polarizing issues, with the majority following the science and the remainder at exponentially higher risk from the Delta variant.
When they turn up sick, they're going to be asking for those same healthcare providers to pick them up and make them healthy again.
Penny Daflos, CTV News, Vancouver.